Good evening, students. Today we are going to discuss a lower limb trauma case, and I would request some of you to participate in the discussion. So, can I have some volunteers for this? Anybody who wants to volunteer, please let us know.
Good evening, sir.
Good evening.
Sir,
Can you,
Dr. Shankar.
Shankar? Good evening, Shankar. Would you like to participate in the discussion?
Yes, sir, I will try.
Very good, very good. Uh, can one or two more people join in the discussion? I think it's something which we experience quite regularly in the emergency, which we are going to talk about. So I don't think there should be any hesitation in joining the interactive discussion. One more person can join in, please. Okay, Shankar, let's move on. If there is no one else, we can proceed. So, as always, the history of this patient. He's a young patient. He's a young adult, about 35 years old. He suffered a road traffic accident, and when he presented to us, the injury had occurred 3 days ago. What was the mode of the road traffic accident? He was driving a truck, and while overtaking or avoiding a vehicle on the oncoming side, when he swerved, he hit another truck from behind. He was initially treated at 3 different hospitals before presenting to our institution. And when he came, the treatment modalities which were in place were a below knee slab on the right side, and along with this, there was a skin traction assembly on the left side. The patient, by the time he came to us, he was hemodynamically stable. So, this is the presenting status of this patient as far as the history is concerned and the treatment history is concerned. And since we were asking him how did the accident occur, he showed us the picture of the vehicle which he was driving. So you can have a look at that. So, Shivam, what do you think? What is the status? Is this a serious accident, or you think it is moderate in intensity or severe in intensity? What is your impression?
Sir, this is a serious or significant trauma history, sir.
Significant trauma. So, well, significant is a very mild word. I think it is if a truck, the front of the truck is appearing like this, and he has rammed into another stationary truck. So this is a very severe accident, a very serious accident which has occurred, and it has the capability of producing what you call serious injuries to the patient. So this is the photograph which is not usually brought by the patient, but if you are inquisitive, I think what I'm trying to impress upon you is don't describe the mechanism of injury as RTA, road traffic accident. it doesn't mean anything. We should go into the depth of what actually happened. And this gives you a lot of insight about the mechanism of injury and what all could have happened when you suffer this sort of an accident. So, when the patient was clinically examined, we found that there was a swelling in both the thigh regions, and on testing further, there was abnormal mobility with crepitus at the junction of proximal two-third and distal two-third in both the thighs. In addition to that, on further neurovascular examination of the limbs, there was a foot drop on the right side, along with sensory deficit in the first dorsal web space. So, what do you think this is indicating? A foot drop and sensory deficit in the first dorsal web space of the right foot. What
Sir,
is it indicating?
maybe injury at the level of knee or below knee cause the common peroneal or superficial peroneal nerve injury.
Okay, very good. So there seems to be a common peroneal nerve injury. It could not be superficial peroneal because there is a foot drop also. So you have
Yes,
to
sir.
take motor and sensory both
Both.
into account, and this points out towards a common peroneal nerve injury. The dorsalis pedis and the posterior tibial pulse were present and equal on both the sides. So this is the clinical examination of this patient. So Shivam, how do you plan to proceed in this particular case? The patient, we have already told you, it is 3 days old injury. Patient is hemodynamically stable. What additional information do you want, or what would you like to do as far as management is concerned?
Sir, I will go for first investigate the patient with X-ray
Very good. Very good. So, what
and routine.
x-rays would you like to order?
Sir, due to the severe injury, I would like to give both the uh, thigh and knee AP and lateral
Okay.
X-ray,
Okay.
and with pelvis and with chest.
Chest. Okay. But there is no respiratory distress. He's not complaining of any pain in the chest. Uh, what else would you like to? So
Then, sir,
you said thigh, both thighs, AP lateral. Okay.
sir,
And
yes, sir.
what else?
Then, sir,
Anything else? So this patient, I already told you that he had a slab. He had a slab put on the right leg. So I think it becomes
mm,
prudent to look at what is there in the leg. So a right
yes,
leg AP and lateral, and uh, one can also have the X-rays
pelvis,
of the foot there. And what else are you wanting?
sir, X-ray of pelvis also.
Pelvis. What do you want to look at the pelvis?
Sir, he is having traction at foot level.
Traction. Is it traction?
Skin traction, sir. He is presented with skin traction. So,
So skin traction may have been applied for the
okay, sir. Distal thigh, sir. Yes, sir.
thigh fracture.
Yes, sir. Yes, sir.
So what is the use for pelvis fracture, pelvis X-ray? Is there any use? If there is